Friends, it's kind of Spoony here, and today I'm wearing my patient advocate hat, not the veteran hat. This message is especially for the Ehlers-Danlos syndrome and hypermobility community, patients, caregivers, and yes, even medical professionals who might be watching. We need to talk about why Dr. William B. Ericson deserves more time on the podium at our upcoming conferences, and why this matters so much to patients like me. My name is Brian Jewell, also known as kind of Spoony. I have hypermobile Ehlers-Danlos syndrome, EDS, and like so many of you, I've spent years struggling with joint pain and injuries that doctors couldn't figure out. For me, it was my knuckles, wrists, and thumbs. They would sublux or partially dislocate during the simplest tasks: pouring a drink, turning a doorknob, typing on a keyboard, playing guitar. The pain was constant and utterly draining. But I didn't have the language to describe what I was going through until I met Dr. Ericson and heard him speak for the first time in 2022. I went to specialist after specialist. MRIs, x-rays, nerve tests, and VA claim examinations all came back normal. Normal. Yet I couldn't use my hands without pain. I was told to try more physical therapy, or that it might be stress, or that nothing more could be done. And I started to wonder if I was crazy, or if I had to live in pain forever. Then I heard about Dr. William B. Ericson, an orthopedic hand surgeon in Seattle who actually understands EDS. I saw other patients online sharing stories of how Dr. Ericson gave them their lives back. I'm talking about people who couldn't hold their kids or brush their teeth because of wrist, thumb, or arm pain. And after surgery with Dr. Ericson, these same people were gardening, cooking, even returning to work. It sounded miraculous, and it was real. Fast forward, and I became one of those people. I traveled to see Dr. Ericson, and it changed my life. He found the problem that no test showed. In my case, severe instability in the thumb joint and hidden synovium layer that was mutilated by the small bones of my wrists. In a delicate surgery, he stabilized my joints. The recovery wasn't easy, but today I can honestly say that I have my hands back. I can type this script, hold a coffee mug, and live without that constant fear of dislocation. And my global pain has reduced significantly, especially in the T-pain region of my upper back and neck. It's night and day. Now, here's the thing. Stories like mine are far too rare because Dr. Ericson is one of the few surgeons truly addressing these hypermobility-related issues. He specializes in painful conditions that do not show on standard tests. Exactly what so many EDS and hypermobile patients deal with. He's been treating EDS patients for over 30 years and is even the co-author of major papers and books on orthopedic management in EDS. The latest of which, Symptomatic, includes references to my own case. This man is a gold mine of knowledge and compassion. But at conferences, surgical solutions for EDS often take a back seat. There's a lot of focus on physical therapy, bracing, pain management, which are all important. But surgery has been denied to patients because it's a last resort. Sure, surgery is risky in EDS. Fragile tissues, longer healing. It's not something to take. Found in the description, I've put the link to the International Scientific Symposium 2025 event page. Go check it out, see what it's about. And if you're attending, even virtually, add your voice during the event to say that you want more of his content. I'll also link any contact info or petition, if we have one by the time it airs, so that you know exactly how to make your voice heard. The EDS community has a motto: together we are strong. This is one of those times we need to come together. It might seem like a small thing, a few extra minutes for a speaker, but it can ripple outwards to thousands of patients getting better care. I believe in this because I've lived it, and I want every person with EDS who's living in pain to have the same chance I had. Dr. Ericson gave me hope and healing. Let's give him the platform to give that hope to the world. Thank you for listening, thank you for supporting, and please share this message. Let's make some noise and get this done.